7:21 is your time, and doctors use the month of August to raise awareness about the importance of immunizations. Doctors say it's vital for all ages, not just kids heading back to school, because vaccinations help in the fight against infectious diseases. Dr. Meredith Maxwell with Toro joining us now with more. Good morning to you.
Good morning.
All right, so are we talking about younger people most vulnerable to complications?
We're talking about everyone. Everybody across the board needs vaccinations, and it's so dependent on medical conditions, age, situation, exposure, those kinds of things. So it's really tailored to each person.
Okay, and for those who are maybe heading back to school, some things that they should be looking out for and some of the vaccinations that they should be getting.
So you want to go to your doctor and bring your vaccination record with you. Sometimes they can look them up online, but sometimes they can't. So definitely have them ready. And everybody can play catch up on certain things that they've missed. So it's really, really tailored to what you've had in the past, and maybe if you've skipped a vaccination before. But I want to impress the importance that it's not just about protecting yourself, but it's also about protecting infirm people, older people, people with chronic conditions, people that can't get vaccinations. So you're actually preventing them from becoming ill as well by getting these vaccinations.
Okay, so for preteens, maybe students going to college as well, pretty important for them to get their vaccinations.
Definitely. Being in a dorm puts you at higher risk for things. Updating vaccinations that have maybe worn off. Definitely want to go to your doctor and bring those with you and tell them where you're going. Are you going to be living in the dorm? Those kinds of things, when your last vaccinations were, so you can decide together about what kind of vaccinations you need.
Now, there's been some debate over whether or not vaccines are safe. You know, what can we say about that?
Vaccines are thoroughly tested before they're put out on the market, and even after they're out, they're very well monitored. The risks associated with vaccinations are very low, and if you do have a reaction, it's very transient and very mild in most cases. Of course, there could be allergic reactions, so you need to tell your doctor your allergies before you get vaccinations. But in general, they're very safe and very important to protect the community as well as your children.
Right, and so when we're talking about a contingent perhaps of parents that say, oh, we're going to opt out of vaccinations for our kids, probably not the best idea.
Well, I think they need to think about that we're seeing disease processes that we haven't seen in a really long time. So people are not vaccinating, and because they're not vaccinating, things are coming back that shouldn't come back. So you really need to think about that and think about protecting your children as well as those around you.
Yeah, and just from the point that you made earlier, just about taking care of the health of others around you. It's not necessarily just your child, but it's those that your child comes into contact with.
Exactly. Think about those that can't get the vaccinations, that are too ill, those that can really be very, very sick from a mild disease. In a healthy individual could actually be deadly in an older, infirmed individual. So you have to think about that as well.
Sure. And now is the time of year when people need to be looking into this, because kids are coming back into contact with so many others. Good idea to get them in and get them vaccinated.
Schools are the #1 place where you can get everything. They bring it home, they bring it to their caretakers, they bring it to the family, and it just spreads out from there. And if kids can't go to school, guess who gets to stay home and help them? It's a big monetary issue as well, because you have to stay home to take care of the child who's infirm and so on and so forth. So it's really important, so talk to your doctor.
It is. It ends up costing you more in the long run, you would think, for not getting a vaccination.
Exactly.
Small price to pay. Dr. Meredith Maxwell, thank you so much for joining us this morning.